Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. You know, clinician safety has always been a top priority, but now more than ever during this COVID-19 crisis, joining us to talk about some of the solutions are Ariel MacTavish and Frank Chan, both joining us here from Medtronic to talk about some software solutions that allow doctors and nurses to manage and adjust ventilators remotely. Welcome to Health Professional Radio, both Frank Chan and Ariel MacTavish.
Hi, Neil. Thank you for having us.
Ariel, what is your background and a little bit of your role there at Medtronic?
Yes, sure. Thanks, Neil. My background is in medical device, and I've worked throughout the industry in different areas of medical device through marketing and other roles. My current role is as the general manager of our respiratory interventions business within Medtronic. Have been doing working within the respiratory space for the past 8 years. And in that business, we have our ventilators as well as all of the accessories and products and airway tubes that are required to ventilate safely a patient, as well as a video laryngoscopy, which is around intubating a patient. So certainly equipment that's very necessary during this crisis.
And Frank, a little bit about yourself and your role at the company as well.
Yeah, Neil. I've been with Medtronic for about 16 years. I've been in a number of different jobs and different businesses. Today, I'm responsible for Medtronic's patient monitoring business, which produces monitoring technologies that really provide insights into the status of a patient, as well as early warning that help caregivers avoid dangerous and costly patient complications that can occur in the hospital.
Now, obviously, we've been in this pandemic for months now, worldwide. The challenges, challenges is kind of an understatement for what this COVID-19 pandemic has brought to us. Let's talk about some of these challenges and how Medtronic is addressing these challenges when it comes to COVID-19 patients and being experts in ventilators, breathability, and patient monitoring. Give us some insight into what you've done.
Sure, I can start there. So I would say in the early days, maybe in the January, February timeframe, we realized, that this was coming up in China. So really one of the challenges in the very beginning was in terms of allocation and reallocating equipment that may have been destined for a different geography, focusing in on helping our colleagues and patients in China. And we early on made the determination that our goal was to really provide access to as many patients as possible with ventilators, knowing that our capacity, as well as all of our competitors together, as we saw the rising demand as the months went on, that none of us could meet all of the needs. So with that, we had open sourced some of our intellectual property for a more simply made ventilator. We saw lots of different types of industries and manufacturers trying to make ventilators to try to help in this situation, but they didn't necessarily have the equipment or the understanding of what was required to make a ventilator. So through open sourcing this, we had hoped to enable more companies to be able to make more, again, to increase the capacity and increase the capability of hopefully treating more patients.
With that surge in production and the focus on operability, how was that successfully managed so that quality wasn't compromised?
Yes. So in terms of our production, we have a very sort of rigorous process as we've ramped up from producing about 200 ventilators a day at the beginning of the year to over 1,000 a day as we speak today. So our operation facility is in Galway, Ireland, and we have worked with all of the component suppliers that have to provide additional components to go into these higher volumes. And yes, the quality has never been sacrificed. It's really been more around getting more people. Everybody has been working really around the clock, doing things that normally would have taken a lot of time and condensing it into shorter amounts of time, but still following rigorous quality systems. And I think that's partly also why we have, as we made the open source planning or open source IP available to others, the goal there really was to have a high quality design available to other manufacturers so that they weren't making some mistakes in design or starting from scratch.
Now, we're going to come back to that. Frank, as an expert in patient monitoring, we've got contact tracing is surging. It's nothing new. It happens in any type of disease tracking, but it's surged now. And the need for monitoring patients from the beginning all the way through any type of medical journey, what types of challenges are posed now with this pandemic?
Neil, a couple of thoughts come to mind. First of all, just the speed of innovation through this pandemic has been really incredible, and the partnership between industry, caregivers, as well as health authorities have really been unprecedented. And, when we think of some of the innovations required to, as you said, remotely monitor patients, whether it's in the hospital or in the home, have really come a long way. And, we've always regarded that kind of remote monitoring capability as a key enabler to getting the right information to the right people at the right time. And this is has never been so important and critical than today with COVID-19, because this kind of technology provides timely alerts when patients deteriorate. It reduces the number of times clinicians need to be at the bedside, so it reduces the risk of cross-infection, and it really allows clinicians who are managing larger and larger patient volumes to deliver quality care more effectively. So, and as it relates to contact tracing, it's an extension of these technologies that allow us to follow the patients then outside of the hospital and into the home.
Ariel, not knowing the ins and outs of the ventilator's operation, the different types of ventilators, isn't it a very hands-on type of procedure?
Yes, the clinician really has to be, these are the most critically ill patients typically that are on a ventilator, and it's required for the clinician to really be at the bedside continuously in the ICU, which is why the ICU has very special requirements in regards to the number of caregivers that are there.
Medtronic, I understand, has developed a first-of-its-kind software solution enabling doctors and nurses to manage and adjust these ventilators remotely. How does it actually work?
Yes, thanks for the question. This was definitely one of the innovations that came out of this crisis mode. So our customers came to us with this request, and really the idea, could we have a longer cable to bring the ventilator out of the room so that they didn't have to go, because if you imagine every time for a COVID patient, every time they need to approach the bedside, they would have to don the PPE equipment and then doff it when they came out. So not only is it posing risk to the healthcare provider, but also certainly the cost and the inconvenience of the PPE. So we kind of interpreted that, and instead of creating the longer cable, our team was able to adapt remote control technology that we had used for internal demonstrations and training to allow the healthcare provider to actually see the controls outside of the patient room in a remote way on any sort of iPhone or iPad. And this enables them to see the control, both see and control the ventilator, still looking at the patient through the window, and they certainly do go in and see the patient also, but this enables them to make more simple observations and simple adjustments that before would have required them to go into the patient room without having to do that.
Now, is this accomplished via Wi-Fi? Do you have to download an app on each device that you're going to be using to monitor these other devices?
Yes. So the way it is set up today, and we're hoping to make it more of a off-the-shelf type of product, but it is something that it has to go through the hospital's internal Wi-Fi system.
Okay.
And then they can get the software through download from us, so they can go onto the website and request it. And we have people that can lead them through the process. They can set it up so that the ventilator is remotely connected with a device within the room, and then that device is what provides the signal out to the physician or the clinician outside of the patient's room.
Now, we're talking about ventilators right now, but is this technology adaptable to other types of devices that are just as essential in treating and, Frank, monitoring patients?
Yeah, Neil, we've also kind of adapted this rapid innovation model for patient monitoring technologies like pulse oximetry, which essentially is technology that measures oxygen levels in the patient, which is important for the respiratory patient that's common to the COVID-19 situation. So, and we've been able to rapidly innovate to be able to remotely set up this remote monitoring capability, which means that we can very quickly set up respiratory monitors with the capability of remotely monitoring patients from outside of the patient rooms. So we've done this in more than a dozen hospitals in the U.S., where hospitals are expanding capacity, but we've also done it in pop-up hospitals, and you've probably heard of hospitals like the Javits Center in New York City, where, for example, we were able to set up 400 respiratory monitors with remote capabilities all over Easter weekend, which is something that normally would have taken, about a week and a half to do. And so, and the impact of this was felt immediately when we had early warning of number of patients who had gone into respiratory decline rapidly. And so this is feedback we actually got from the governor's office. So these innovations are really life-saving advancements for patients and caregivers on the front lines.
We'd like to learn much more. Where can our listeners learn some more online about Medtronic and the technology that you're developing there?
Well, Neil, on Medtronic.com, we have a COVID-19 pandemic link that people can go to and look at what kind of solutions the entire corporation has brought to bear. And, what we've really done is we've mobilized our global organization around this with the focus on how we serve our caregivers and then, by extension, their patients better.
Well, Ariel, Frank, I thank you both for joining us here on Health Professional Radio this morning. Some exciting news, some promising news.
Yeah, thanks a lot,
Thank you
Neil.
very much for the opportunity. It was great to have the conversation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.